Ulo mo, Grace? Good day, sir. I am Sandine as ISIDRO, and today I will be performing the prenatal care and LEOPOLD'S maneuver. Equipment, tape measure, mother-baby book, tetanus toxoid vaccine, 3cc syringe. Procedure. First is identify the client and explain the procedure. Rationale is to prevent errors, this enhancing client to be cooperative and fund his confidence. Next is assess client health history, which includes personal, family, social, previous obstetrical and present obstetrical data information gathered by healthcare provider, which help establish baseline data, identify teaching needs. Next is assess the client's knowledge and guidelines for health, pregnant, and antepartal care. Rationale is to provide baseline data to identify teaching needs. Serve as a baseline data for succeeding prenatal care. Next is review the plans for antepartal care visits, examinations, and laboratory findings. Rationale is to serve as a baseline data for succeeding prenatal care. Next is monitor vital signs of the client. Rationale is to provide a baseline data or future comparison and identification of factors that may place the client at risk for problems. Next is measure the height on initial visit and monitor the weight in succeeding visit. Weighing is an important part of each prenatal examination. A gain or decrease in weight will affect pregnancy. Next is conduct physical examination. Begin assessing from head to toe to come with a general impression of women's health and well-being. Next is perform abdominal examination. Instruct the client to empty or void her bladder to promote comfort on the part of the client. Next is position the client in the dorsal recumbent. Proper positioning relaxes both mother and baby. It also facilitates the easy location, presentation, and lie of the uterus. Next is drape client and expose the abdomen from the level of the xiphoid process down to the symphysis pubis. Rationale is to provide privacy. Next is measure the fundic height using tape measure starting at 0 cm to determine the gestation and growth of the uterus, the fetus. Next is the centimeter side of the tape measure must be facing the abdomen, where the inch side is facing the examiner. Rationale is to prevent bias. Next is locate the highest point of the fundus. Leave one hand in place and secure the end of the tape. Measure to the fundus. Measure down to the top of the symphysis pubis to measure the fundic height correctly. Next is document the measurement in centimeter. Rationale is to compare with the calculated gestation. Next is perform the LEOPOLD'S maneuver to assess the condition and fetal presentation. Next is warm two hands by rubbing one against the other before placing them on the abdomen. The use of warm hands during the palpation prevents tension and hardening of the abdominal muscles, favoring good results. Next is perform the 4 maneuvers. During the first 3 maneuvers, the examiner stands at the side of the client bed and faces the client. The position favors accurate performance of the maneuver. Next is first maneuver. Fundal grip with both hands palpate upper abdomen and fundus. For a consistency, head is round, hard, breech is well defined. Mobility, head moves independently, breech less mobile, to determine the fetal part lying in the fundus. Next is second maneuver, umbilical grip. With both hands moving down, palpate the side of the uterus from the top to bottom. One side smooth hard, resistant surface, back, knees and elbows. Next is other side, angular modulation. To determine the fetal back for fetal heart tone, usually found in the left lower quadrant. Next is third maneuver, the pollex grip. First is with the right and over the symphysis, identify presenting part by grasping the lower abdomen with thumb and fingers. Assess whether the presenting part is engaged in the pelvis. If head is engaged, it will not move. If it is soft, it is the back to determine engagement of the presenting part. Next is fourth maneuver, pelvic grip. First is the nurse alters positions by turning toward the patient's feet with both hands. Assist the descent of the presenting part by locating the cephalic prominence of brow. Place your fingers on both sides of uterus about 2 inches above the inguinal ligament. Press downwards and inwards. If the fetal back is palpated, it meets no obstruction. The other hand will meet obstruction. The fetal brow is palpated to determine the degree of flexions of the fetal head. Next is reposition the client to make the clients feel comfortable. Next is administer the tetanus toxoid vaccine following the recommended schedule. Tetanus toxoid 1 gives as easy as possible. Tetanus toxoid 2 after a month later. Tetanus toxoid 3 at least 6 months later. TT4 at least 1 year later. TT5 at about one year later after TT4. To prevent both the mother and newborn from tetanus. Next is administer iron folate supplement until the second month postpartum to regain iron loss during childbirth. Next is administer malaria prophylaxis to all pregnant women in endemic areas as ordered by the doctor. Give 2 tablets of chloroquine phosphate at 250 mg every week for the durations of pregnancy. Women are most likely to develop malaria when pregnant. Malaria can cause miscarriage, premature labor, small babies, and stillbirth. Next is provide and promote health teaching on good nutrition, personal hygiene, and enough rest and sleep. Rationale is to ensure an optimum environment for health growth and development. Next is discuss with the client her expectations about pregnancy, which includes the danger signs of pregnancy, labor, delivery, and impact on the family. Psychological assessment is important to assist the client in identifying areas of need to ensure the optimal fetal growth and development. Next is plan with the mother the preparations for breastfeeding the baby. Rationale is to know the advantage of breastfeeding to newborn. Next is discuss the importance of prenatal and subsequent visits. Rationale is for follow-up care. Ma'am, I am Sandy ISIDRO from Notre Dame Caparong College. Ask ko po muna kayo ma'am if gusto niyo po umihi. Measure ko lang po yung convict height ni ma'am. cm. Palpate ko lang po yung tiyan niyo mga para malaman po natin kung saan po yung side ng ulo ni baby.